Rheumatoid arthritis, getting to the true root cause. Hi everyone, I'm Dr. Michael Johnson. I'm a board certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983. So 39 years. I started consulting with other doctors in 2006, and we have a doctors only message board at txfibro.com. So let's talk about this because it's important. Rheumatoid arthritis, autoimmune condition. Your immune system is attacking your body. Why? Well, I'm going to tell you the true root cause. It's iron dysregulation. What do I mean by that? Well, usually it's iron overload. Too much iron stored in your system. How do I know? You run blood work. You can run an easy test. It's a ferritin test. Costs you $29. Normal ferritin should be 20 to 50. I just saw a patient this morning, 1,353. I'm not joking. Other patients, 584. Another patient, myself, 365. Another patient, 378. That was just today. So why so much iron? Well, think about it. When you're a little kid, you're eating the cereal, reading the back of the box, and it's all enriched with iron. It's iron fortified. Every single packaged good is iron fortified. Every single flour, breads, pastas, it's just not the gluten. And if you are autoimmune rheumatoid, we're going to talk about that. But it's the iron fortification. We're overwhelmed with iron. So it's a simple blood test, a ferritin test. It measures the amount of stored iron in your system. As I mentioned, my ferritin was 365. Normal is 20 to 50. Now, there are some out there who will say, no, you need a complete iron panel. You need a magnesium, zinc, and copper panel. That's going to run you like $200 to $250. Most people with a chronic condition looking for answers just to see if they have the condition really don't want to spend that much money. But they will spend $29 or $39 or even $49 to check that ferritin. And that's the starting point. And you don't even need a doctor to order it for you. You can get it from just Googling, order my own lab near me. There's a place called Any Lab Test Now. I'll read a few of them. Request a Lab. There's one. Walk-in Lab, Quest Direct, LabCorp On Demand, and Direct Labs. All you got to do, walk in, they draw your blood, you'll get the results in 3 to 4 days. A week at the most. So, okay, why hasn't my doctor told me about this? Most MDs, all they know, especially with rheumatoid arthritis, you already know this, folks, is drugs. That's it. They're looking for the next big new drug. Because look at the symptoms associated with iron overload. Inflammation. You have RA. You're massively inflamed. And you can say, well, what about my child? They have juvenile rheumatoid arthritis. It can be inherited. It can be a genetic consequence. We're going to talk about that. So inflammation, numbness, tiredness or fatigue, weakness, weight loss or gain, abdominal pain, high blood sugar levels, hyperpigmentation of the skin or bronzing, loss of sex drive, reduction in the testicles in males. In females, reduced or absent menstruation. If it continues, look at this: chronic pain, arthritis, liver disease or cirrhosis of the liver, which is permanent scarring, enlargement of the liver, diabetes, severe thyroid disorders. And that happened to me. I was Hashimoto's and I flipped over to Graves. Hypo to hyper. Heart disease. I was diagnosed with congestive heart failure. My original BNP was 1,024. Severe heart failure is anything above 900. I have gone with this program from 1,024 over the course of 2 months down to 563. That's why I'm here talking to you. I'm living it. That's what you get from me versus any other doctor out there. I'm living it. Pancreatitis, high cholesterol. We'll talk about that in a minute. Cancer. Folks, if you just Google cancer and high iron, you'll see for yourself. You don't have to believe a word I say. Just go to Dr. Google and Google cancer and high iron. Stroke, kidney disease, lung disease. It's serious. It's very serious, but it's not that serious that it can't be corrected. Let's talk about cholesterol because everybody and their uncle is on a statin, a cholesterol medication. They don't need to be. You need cholesterol for your brain. You need cholesterol to insulate your nerves. You need cholesterol to make hormones, to live. So, cholesterol. When iron is high, magnesium is low. When magnesium levels are low, the enzyme that creates cholesterol, the HMG coenzyme A, goes into overdrive and creates excess cholesterol. And look at stress, emotional stress, environmental stress, heavy metals, poor diet, lack of sleep, toxins, EMFs, that can cause high iron and low magnesium. And what about aging? Aging is literally rusting. You're rusting away. It's iron oxidation due to too much iron in your system. It's inside the mitochondria, which stops the production of ATP. ATP is the energy carrying molecule inside the cell. That's the cellular event of aging. All for lack of a simple blood test called ferritin that you can order yourself for $29. I can't make this up. I've been in practice 39 years. And physicians, they don't recognize this. You know why? Because there isn't a drug for it, folks. If there was a drug for it, like a statin, they'd be all over it. They would be all over it. I've had drug reps as patients. They tell the physicians what to do. It's crazy. So you have the ferritin test. It's 200. Normal is 20 to 50. Now what? You got to dig a little deeper. So here's the blood work needed to assess the iron overload syndrome. Serum iron, iron saturation, total iron binding capacity. The ferritin, like I said, should be 20 to 50. That's where you start. Serum transferrin, copper, ceruloplasmin. People think of glutathione as the master antioxidant. It's really ceruloplasmin. Plus, it makes copper available, and you need copper. Not too much, not too little. It's like Goldilocks. Just the right amount. Same thing with magnesium and zinc, hemoglobin. So I am, and you'll see this on my blood work, I'm going to show it to you next. I am slightly anemic. And as a result of being anemic, one of the things that you can do is donate blood, but they won't take you if your hemoglobin is below 13. So my hemoglobin was 11.7. Vitamin A should be more or 3 times higher than your vitamin D. Most people, like myself, have it the exact opposite. So if you have too little vitamin A and too much iron, you're going to be anemic. You can say, wait, anemia, are you kidding? That's low iron. That can be too much iron and too little vitamin A. And guess what? Coming back to gluten sensitivity. That's genetic, but it's also too little vitamin A. Red blood cells, hematocrit. So that's what you're looking for. And as an example, here is my blood work. So there's no worry about HIPAA. My serum iron was low at 69. Look at the total iron binding capacity. That's low, 255. Look at my serum ferritin, folks. 365. And like I said, today I just had a gentleman, 1,393. Serum transferrin is low, should be 300, it's 217. Copper was high, ceruloplasmin was low, magnesium a little high, zinc was a little low. That's what I talked about with the hemoglobin. Remember that, 11.7. My vitamin A and vitamin D are exact opposite. They're reversed. Vitamin A should be 3 times higher than D. My red blood cells and hematocrit was low. I also have an issue with inflammation. So let me just give you a little history. My history goes back to 2008. I was diagnosed with Hashimoto's. It's a thyroid condition, autoimmune. The immune system's attacking my thyroid. Most people with an autoimmune disease have multiple autoimmune diseases. So it's likely with rheumatoid arthritis, you may have something else going on. I also developed peripheral neuropathy, pain and numbness in my feet. Stem cell helped me. Stem cell therapy didn't help the neuropathy. It helped me with my MS. I was able to walk better, stand longer. When I went in for stem cell, I could only stand 10 or 15 minutes. I could only walk 10 or 15 minutes. After the stem cell, what worked for me and a number of our patients, not all, unfortunately, but what helped me was I could walk 2 hours after that. Well, everything's going good until a few months ago. January 2022, I wake up in the morning, terrible abdominal pain. I've had this before, 4 or 5 years ago. I know it's my gallbladder. It's got to come out. I go into the hospital. I had pneumonia. They gave me Lasix. Lasix to help clear the lungs. It's a diuretic. They gave me too much. It shut down my kidneys, shut down my heart. I have congested heart failure and kidney disease. Unfortunately, kidney failure, acute kidney failure. I also had a kidney stone, which I just had removed last week, and AFib, because now my Hashimoto's has flipped over to Graves, hypothyroid to hyperthyroid. My point being, folks, is I'm living it. That's how well I know what's going on, not just with myself, but with you. That's how I know that you don't leave any stone unturned. That's how I know that you just don't do the iron overload blood work that I just laid out for you. You do complete blood work. And along with the complete blood work, you do genetic testing. So you get a complete metabolic panel. This will test your glucose levels. Why is glucose important? Your brain and nerves need 2 things, fuel and activation. Fuel is oxygen and glucose. Gut function, very important. You got to have enough hydrochloric acid to digest your food. Adrenal function, your adrenal glands are your stress glands. Kidney function, I just told you about that. And liver function, to name a few. You want a complete lipid panel. You want to look at your cholesterol, your triglycerides, your cholesterol and HDL ratio, which shows you your risk of suffering a heart attack. Your HDL and LDLs. You want a CBC with auto diff, looking at your red and white blood cells. You want a complete thyroid panel. Why? Because thyroid drives your metabolism. And then, like I told you, C-reactive protein and homocysteine, you're checking for inflammation. And so this is what you're going to get. You're going to get a book. You're going to get a book. This book, this is me. It's my blood work, so there's nothing to worry about, like I said, with HIPAA. This is why we put it into our database, and you get a nice printout. So there's lab ranges. The abnormals are in red, and functional ranges, the abnormals are in yellow. That was me a few months ago, coming out of the hospital. It wasn't good. Now, like I said, this is very important. So you do the iron overload blood work, you do complete blood work, you do genetic testing. So I started with genetic testing 2013, 2014. Dr. Kendall Stewart, he's a physician down in Austin, Texas, great guy, a lot of great information. Dr. Ben Lynch, he's up in the Northwest. Again, great guy, great information. Dr. Mark Harris, tons of information. And now we're utilizing Dr. Bob Miller and his functional genomics. Really a lot of great information. And he has worked out the whole iron SNP equation, for lack of a better term. So if you combine iron with hydrogen peroxide, you get a hydroxyl radical. And that's not good. It's very toxic. It's called a Fenton reaction. And you don't want that. So along with iron, you may want to look at glutamate, histamine, mold, EMFs, homocysteine, dopamine, sulfites, and something called an NADPH steel. Guess what? I have all of those. That's why I listed those out. So you see, genetic variations, similar to what I just told you with iron, can affect inflammation, detox pathways, so maybe you're not detoxing, brain chemicals, hormone levels, organ function, and vitamin and mineral levels. So again, you don't want to leave any stone unturned. And like I said, I think Dr. Miller he's done a great job. And he deserves a lot of credit. But there are others who deserve credit. There is a book called Strands of Health by Rick Malter. He talks about HTMA, hair tissue mineral analysis. There's another great book called Cure Your Fatigue by Morley Robbins. Normally I have the book to show you, and I apologize. It's at home. I just two great resources. I disagree with Morley a little bit. He takes a cookie cutter approach. I say, and I agree with Dr. Bob Miller, it has to be specific for the patient. Two patients can have rheumatoid arthritis and have two totally different things going on. You really have to look at the individual. Plus, Dr. Miller really has laid this all out. And Morley Robbins does a great job in his book. He does a great job laying out mitochondrial support. Mitochondria are the powerhouses, for lack of a better term, in your cell. They're like a big warehouse. But I don't like the cookie cutter approach. And, Morley Robbins, he's not really big on zinc or calcium. Sometimes patients need some zinc or calcium. So we kind of split hairs with that one. Ray Peat talks about iron overload. I should give him credit, although I don't agree with how he goes about addressing it. And I have a very, very good friend, Dr. Robert Selig. He's very much into hair tissue mineral analysis. I call him the master of minerals. And finally, a very good friend of mine who said, you got to circle back and look at Dr. Miller's work. And that's Dr. Joel Rosen. He's the adrenal ninja. Good friend of mine down in Florida. So, just great men. Well, you may have this question about now. How do I know if this will work for me? Look, I've tried everything. I have rheumatoid arthritis. I'm so sick of trying different treatments. All these drugs, all this, that, and the other thing. All these supplements, homeopathics. How do I know? Take the $29 ferritin test. That's the starting point. You can order it on your own. If it's above 50 or below 20, you've got iron dysregulation. You've got some issues. We need to open up that Pandora's box and get to the bottom of what's going on. Don't leave any stone unturned. Will this work for other conditions? Folks, I think this is the key to any chronic condition out there. I really feel that, and I'm living it. I just told you about my heart failure and how it's improving. Well, how long and how much? First thing I'll say is we do offer financing. We go 12, 18, and 24-month programs. This takes work. I'm not about to kid you. And so what we do is we charge $11,995 for 12 months, $14,995 for 18 months, and $19,995 for 24 months. Well, should I do 12 or 24? Most people know. They know how severe they are. They know it's how long, they can tell innately. Most people tell me. Very few people come to me and say, well, what do you recommend? And then we'll just go through everything. It's like, okay, let's get some testing and see where you're at. Let's just not do the ferritin test. Let's add to that. Let's add the magnesium, zinc, and copper. Let's add the iron. Let's take a look. Look at all those panels. We can get a good assessment. Then we roll into all of the complete blood work. Complete metabolic panel. Complete lipid panel. Complete thyroid panel. CBC with auto diff. Finally, the genetic testing. So, if you would like to see if you can qualify to be a patient, you can email me at drmlj83@gmail.com. And I'll give you that again. And what do I mean by qualify as a patient? Well, I've had COPD patients who refused to quit smoking. And they promised me they would. I don't want to work with people like that. I've had people tell me they're going to change their diet. They're going to start eating healthier. They're not going to eat junk food. And then they're still drinking a 12-pack of Diet Mountain Dew a day. That's not going to work. You have to meet me halfway. So that's what I mean by qualify as a patient. I don't accept everybody as a patient, and those are examples why I would not. So, yeah. Share this video with your friends and family on social media. Please, help me help others. If you're watching this on YouTube, like this video and subscribe. And like I told you, there's my email again, drmlj83@gmail.com. You got any questions, just shoot me an email. I get tons of emails a day. Please give me 24 hours to get back to you, because we're very busy. We see a lot of patients. We help a lot of people. That's what matters. That's all that matters. So I'm Dr. Michael Johnson. Thank you for taking the time to watch this video. Tried to keep it under 30 minutes. We've gotten that. And shoot me an email, drmlj83@gmail.com. I'm Dr. Michael Johnson. Thank you. And I look forward to helping you in the future.